Living with HIV can feel like you're carrying an invisible weight, but nothing pulls you down quite like the constant struggle with diarrhea. It's not just an occasional annoyance. For many, it's a chronic, painful reminder that their body is under attack. Imagine feeling the urge to go all day, every day, with no warning. No control. No relief. That's the reality for thousands of people living with HIV. And it's more than just uncomfortable, it can lead to serious health complications. But why does it happen? What's causing it? And more importantly, how can you manage it before it leads to bigger problems? Let's dive in and break it all down in simple, clear terms. What causes diarrhea in people with HIV? Diarrhea in HIV is complicated. It's like an uninvited guest that refuses to leave. And here's why: HIV doesn't just affect your immune system, it directly impacts your gut, which is home to more than half of your body's antibody-producing cells. These cells are like soldiers, keeping your digestion and immune defense strong. When HIV attacks them, the intestine can't function the way it's supposed to. Your gut is supposed to digest food and absorb nutrients efficiently, but when HIV damages it, things go haywire. That's when diarrhea starts. In fact, for many living with HIV, it becomes chronic, lasting more than 4 weeks with multiple watery bowel movements a day. Chronic diarrhea isn't just about discomfort, it leads to dehydration, malnutrition, and in extreme cases, something called wasting, a serious loss of body weight and muscle mass. The impact of medications on the gut. Now, let's talk about another common trigger for diarrhea: medications. HIV treatment, especially antiretroviral therapy, ART, is a lifesaver. It can suppress the virus to undetectable levels, which not only keeps you healthy but also prevents transmission. But here's the catch: while these meds are great for fighting the virus, some of them, particularly protease inhibitors, PIs, can upset your stomach and cause severe diarrhea. Newer protease inhibitors like Prozista or Iodaz are better tolerated, but for some, the side effects remain. On top of that, other HIV medications can also lead to gastrointestinal distress. This makes it tricky to balance treating HIV while keeping the digestive system in check. Other causes of diarrhea, more than just the virus. But wait, it's not always the HIV or the meds that are to blame. Your diet, infections, and other health conditions can all add fuel to the fire. In some cases, opportunistic infections, those that show up when your immune system is weak, can cause diarrhea. Viruses like cytomegalovirus, CMV, which are rare in people with strong immune systems, can wreak havoc in those with HIV. Even antibiotics used to treat other HIV-related issues can destroy the healthy bacteria in your gut. These good bacteria are your body's natural defense against infection and help with digestion. When they're wiped out, diarrhea can strike again. What to do if diarrhea strikes: understanding the triggers. If you're living with HIV, you know that small things can trigger major reactions. Diarrhea is no different. Certain foods, supplements, and even everyday habits can set off a bout of diarrhea or make it worse. You've got to be strategic about what you eat. High-fat foods, dried fruits like prunes, fresh fruit juices, alcohol, caffeine, and high-fiber foods can all make diarrhea worse. Even some artificial sweeteners, like the ones in sugar-free gum, are a no-go. The key is knowing your body and its limits. When diarrhea sticks around for more than a few days, it's time to seek medical advice. Chronic diarrhea, that's diarrhea that lasts more than 4 weeks, can be serious and needs proper treatment. The seriousness of chronic diarrhea: when should you worry? Let's be clear, diarrhea is annoying, but when it becomes chronic, it can turn dangerous fast. Picture losing up to a gallon of water a day from your body. That's a ton of fluid. And if you're not replenishing those fluids, you'll quickly become dehydrated. Plus, you're losing vital electrolytes like sodium and potassium that your body needs to function. Here's the real danger: chronic diarrhea can lead to malnutrition and wasting. Wasting occurs when you lose 10% or more of your body weight without trying. It's a sign your body isn't getting the nutrients it needs to stay strong, and it's a serious complication of HIV. If diarrhea becomes a problem, you've got to act fast. Blood tests, stool samples, and even immune system tests can help your doctor figure out what's causing it. If necessary, more advanced tests like an endoscopy or colonoscopy may be required to get to the root of the issue. Treating diarrhea, how to find relief. So, how do you treat diarrhea when you have HIV? First, it depends on what's causing it. If an opportunistic infection is to blame, your doctor will prescribe the necessary treatment. But if it's not an infection, and your virus levels are already low thanks to ART, there are other ways to manage diarrhea. Antimotility agents like loperamide, Imodium, can help slow things down. Pepto-Bismol, bismuth subsalicylate, is another over-the-counter option that many find helpful. And while these treatments can offer relief, never stop your HIV meds without consulting your doctor, even if the diarrhea is bad. Stopping medication can cause more harm than good, and there are usually ways to work around side effects. Managing diarrhea with diet, small changes, big results. Let's talk about food again. Managing diarrhea often starts with what you eat. The goal is to make your meals gentle on your stomach while still giving your body the nutrients it needs. Here are some foods that can help. Bananas, oatmeal or cream of wheat, plain pasta, boiled potatoes, applesauce, yogurt with live cultures, great for rebuilding gut health. Eating smaller, more frequent meals can also help. And don't forget to stay hydrated, but sip on fluids between meals rather than during them, as drinking while eating can speed up the movement of food through your gut, worsening diarrhea. Supplements and hydration, keeping your body strong. Supplements can be another way to help your gut heal and stay healthy. Probiotics, acidophilus capsules, and soluble fiber products like Metamucil can help. But before you start any supplement, talk to your healthcare provider to make sure there are no interactions with your current HIV medications. Hydration is key. Drink plenty of fluids, water, ginger ale, peppermint tea, or sports drinks with electrolytes. But watch out for sugary drinks, as too much sugar can make diarrhea worse. Staying hydrated helps your body recover faster and prevents the complications of dehydration. Wrapping up, take control of your health. Diarrhea might seem like a small issue, but for people living with HIV, it can be a major problem. The good news is that you can manage it. By understanding the causes, being smart about your diet, and working with your healthcare team, you can keep it under control. Your health isn't just about fighting the virus, it's about living well. Pay attention to your body, stay hydrated, and don't be afraid to reach out for help when you need it. When you take the right steps, diarrhea doesn't have to rule your life. Keep your health in check, and live the life you deserve.